Imagine a world where reality often blurs with fragments of the imagination, where voices that aren't physically present engage in persistent conversations. This is the reality for many individuals living with schizophrenia, a complex mental disorder characterized by a profound disruption in cognition and emotion, affecting the most fundamental human attributes: language, thought, perception, and sense of self. Schizophrenia affects about 1% of the population globally. It profoundly impacts not only those who have it, but also their families and friends. The onset is most common in late adolescence and early adulthood, often disrupting a person's ability to study, work, and connect with others. One of the most stubborn myths about schizophrenia is that it equates to having multiple personalities. Contrary to this common misconception, schizophrenia is primarily about experiencing a distorted perception of reality. Think hallucinations and delusions, not multiple distinct identities as seen in dissociative identity disorder. Another widespread myth is that individuals with schizophrenia are typically violent. Research, however, tells a different story. Most people with schizophrenia are more likely to be victims of violence rather than perpetrators. Understanding these truths helps in reducing the stigma and fear often associated with the disorder. Turning our focus to the symptoms, individuals with schizophrenia might experience hallucinations, delusions, disorganized thinking, and significant social withdrawal. These symptoms can be mystifying not only to the person experiencing them, but also to those around them. Schizophrenia manifests in several forms. Paranoid schizophrenia, for instance, is marked by intense delusions and hallucinations. Disorganized schizophrenia affects speech and behavior, leading to a decline in daily functioning. Catatonic schizophrenia includes unusual movements or stillness, and residual schizophrenia involves a reduction in the intensity of symptoms. Lastly, undifferentiated schizophrenia is a category used when symptoms don't clearly fall into the aforementioned types. Diagnosing schizophrenia involves a combination of medical and psychological evaluations. It's crucial to note that early diagnosis and treatment significantly improve outcomes. Treatment usually combines medication, therapy, and lifestyle adjustments. Medications can help manage the symptoms, while various therapies and support systems assist in coping with the disorder. The role of counseling and robust support networks cannot be overstated. They provide essential help and guidance not just to those with schizophrenia, but also to their families and caregivers. Building a supportive environment encourages understanding and aids in recovery. When interacting with someone who has schizophrenia, it's vital to show empathy, patience, and respect. Avoid making assumptions about their capabilities and experiences. A supportive and non-judgmental approach can make a significant difference. In conclusion, understanding schizophrenia is the first step towards demystifying the disorder and supporting those affected by it. Awareness and accurate information can dismantle stigmas and foster a more inclusive society. If you or someone you know needs more information or assistance, contacting mental health services or helplines in your area can provide the necessary support and guidance. Remember, knowledge empowers us to make a difference. Sharing accurate information and offering support can change lives.